Our next panel of speakers will focus on professional training. Our moderator is Renee McLeod-Sordjan. Professor Sordjan is a nurse practitioner for the Department of Medicine at North Shore LIJ at Franklin, which is very familiar to me since it's my home in addition, and a women's health nurse practitioner in private practice. She is currently a medical ethics attending for the Department of Medicine at the North Shore LIJ Health System. She's a clinical assistant professor in the Leinhardt School of Nursing Graduate Department. Professor McLeod-Sordjan, please begin, and you can introduce the panelists going forward. Thanks very much for participating.
Thank you. Thank you, Dr. Ossoff. I really appreciate our connection at Franklin. So I'd like to introduce our panelists. Our first speaker is Dr. Robert Arnold. Dr. Arnold's research and educational activities focus on teaching ethics to residents, improving doctor-patient communication regarding palliative care, and changing the culture by developing educational programs in specialties ranging from oncology to critical care medicine. He is currently developing a structured curriculum on doctor-patient communication for fellows in critical care medicine. He is currently also having clinical activities focusing on providing palliative care consults in tertiary care hospitals and providing primary care to HIV seropositive inpatients. He was the president of the Society of Bioethics and Humanities and of the American Association of Palliative and Hospice Medicine. Our second speaker, Dr. Elaine Wittenberg, is an associate professor in the Division of Nursing Research and Education at the City of Hope Comprehensive Center in California. She holds a PhD in communication from the University of Oklahoma, and with a focus on hospice and palliative care, she's the co-author of several books, including Communication as Comfort, Multiple Voices in Palliative Care and Dying with Comfort, Family Illness Narratives and Early Palliative Care. Her latest volume, Communication and Palliative Nursing, details the comfort communication curriculum that provides nurses with the instruction on palliative care communication. Dr. Wittenberg is the lead editor of the textbook of palliative care communication, scheduled for publication this year by Oxford University Press. She's the co-founder of the Palliative Care Communication Institute, an online resource that provides information on communication training and offers providers, patients, and family resources developed through rigorous communication research. Dr. Wittenberg and her colleagues also recently launched Health Communication, a free app that provides ease to use in communication strategies. Help me in welcoming them as we go into the second panel and hopefully go into some of the communication strategies for our urging communication with doctors, physicians, and other clinicians.